Welcome to our presentation for the U21 HSG 2023 Student Challenge. We will be focusing on air pollution and its effects on respiratory health. Here's an introduction to our team, Crew 02, showing our individual roles and contributions. Meet our case study, Evan's lovely family. Each day, people like Evan's family are exposed to particulate matter, ozone, carbon monoxide, and other pollutants. These may come from vehicular and factory emissions, as well as infrastructure demolitions, garbage fires, and wildfires. Indoor pollution may come from heating, tobacco products, and outdoor pollution. When they experience coughing and breathing difficulties, they're often recommended inhalers and medication by healthcare workers. Today, 2.4 billion people cook and heat their homes with kerosene, biomass, or coal, resulting in an estimated 3.2 million deaths in 2020. Developing countries and low-income areas are those most affected, with an estimated 2.1 billion people still lacking access to clean fuels in 2030. The health effects of indoor air pollution include cardiac diseases, lung cancer, lower respiratory infection, and stroke, with long-term effects still unknown. Governments both subsidize the usage of clean fuels and educate people about the usage of clean fuels, as well as the installation of air filters in houses closest to factories or industrial districts. Wildfires have increased worldwide. Inhaling the particulate matter released from the fire smoke will affect the respiratory health of susceptible people and may trigger asthma, COPD, and increase hospitalizations. To reduce exposure to wildfire smoke and other air pollutants, air quality indexes, or AQI, have developed around the world, using data from air quality monitors around the world to alert the population to dangerous levels of air pollution. However, we lack evidence confirming that these monitoring systems actually improve health outcomes. Therefore, we suggest a dedicated research initiatives to compare health outcomes, such as the number of emergency room visits for respiratory distress, in areas with and without AQI. Race plays a significant role in determining how much an individual will suffer from the effects of air pollution, as does socioeconomic level. Studies have shown that Black, Hispanic, and Asian people have higher rates of exposure to PM 2.5. This is rooted in historical redlining, leading to the development of fossil fuel extraction sites in their communities. This creates racially segregated areas of severe environmental damages, causing an unequal distribution of health impacts. On the other hand, families belonging to a low socioeconomic level are associated with suffering greater health complications due to air pollution. This group of people have less access to resources that can protect them from the effects of air pollution on their health. Organizations can host donation programs for N95 respirators, as well as setting up government funding to support low-income families in installing HVAC. Graduating health trainees currently face a knowledge gap in understanding, managing, and mitigating the consequences of climate change. Implementing climate science and public health education through university programs and incorporating it into existing curricula of medical, nursing, dentistry, and public health schools. Definition of a core set of climate and health educational goals, such as identifying key local effects of climate change on health, establishment of a specific framework for climate and health curricular content. Embracing a lifelong learning approach that integrates climate education into school curricula. Air pollution is a risk factor in childhood asthma, COPD, lung cancer, and frequent respiratory tract infections and hospitalizations. 99% of the world's population lives in an environment with poor air quality. In order to combat the problem of outdoor air pollution, we recommend the implementation of robust carbon pricing policies and investment in the development of green hydrogen technologies. These together will combat air pollution and promote a more sustainable future. As such, indoor air pollution, ambient air pollution, and wildfire pollution need evidence-based solutions, while social determinants need consideration and interdisciplinary teams must be built for educating public and healthcare workers.